Welcome, everyone. Today we'll explore a topic that's been shaking up the healthcare world, consumerism. Yes, we're talking about patients shopping for healthcare as if they were picking out the latest gadget on Amazon. Fun, right? Well, it's not quite that simple. We'll explore how consumerism changes healthcare and what it means for patients, providers, and managers alike. Let's kick things off with the basics. Healthcare consumerism has become a hot topic, with patients shouldering more costs through high deductible plans and copays and premiums. This has transformed patients from passive recipients of care into active decision makers. This presents opportunities and challenges for healthcare providers as they adjust to a world where patients are more cost conscious and value driven. Today, we'll explore what peer-reviewed literature and video sources tell us about this shift and how they can apply these lessons in real-world management. So, what does the research say about healthcare consumerism? According to research, healthcare advertisements focus more on patient-centered care, although they're sneakily incorporating consumerism. Providers, particularly in areas like cosmetic surgery, market the patient experience heavily while downplaying their credentials. Meanwhile, studies highlight price transparency as the game changer, with patients demanding more precise, accessible information about healthcare cost. It's not all sunshine and savings. Researchers offer a more cautious perspective, especially in pediatrics. They found that too much consumerism can harm patient outcomes, like when families focus on options rather than trusting medical advice. Imagine being at a buffet and picking everything except the healthy stuff. Consumerism can be great, but sometimes it leads to poor choices. First video I reviewed, Impact of Healthcare Consumerism on How We Deliver Care, aligns closely with recent studies. It points out that patients are involved in healthcare decisions, meaning providers must engage them on cost and value. That's a switch. It's like a reality check for healthcare providers. Patients care about what they're getting for their money, and that's reshaping how care is delivered. Next step is the effect of consumerism on healthcare. It mirrors current research on price transparency. The video explains how patients shop for healthcare like they would for a new phone. Providers now must prove that they offer the best value, which means adopting strategies like cost accounting and focusing on delivery of high quality care at a competitive price. Finally, in consumerism and healthcare, we see trending themes. The video highlights that giving patients more choices can empower them, but there's also a risk. Lindley pointed out that too much emphasis on choice without proper medical guidance can sometimes lead to poor health outcomes, mainly when the patients prioritize cost over medical advice. So what's the big takeaway here? Well, I kind of feel like a broken record, but consumerism is changing the patient-provider relationship. Patients aren't just sitting back and taking what's prescribed anymore. They're actively comparing prices, checking reviews, and demanding value. While this shift drives transparency and more patient engagement, we must also be cautious. As Lindley and his team of researchers warned, focusing too much on choice could lead us away from sound medical advice. Now, how does this apply to healthcare management? Well, if you're in management role, then you must start thinking like a consumer. That means investing in systems that provide clear pricing and developing efficient care models and training your staff to explain the value behind their services. Essentially, you ensure patients that they know that they're getting quality care at a reasonable price. From a business perspective, consumerism is a guiding principle for decision making. For example, hospitals that master cost accounting and develop precise pricing models will attract more cost conscious consumers. Also, engaging with patients to understand their needs can help ensure that you shape the services to their needs. Remember, patients are looking for value. If you can show them you provide it, you'll be ahead of the competition. Let's wrap things up. Consumerism in healthcare is here to stay, and it's changing the way we deliver care. Peer reviewed literature and the videos I studied suggest that patients drive these changes and emphasizing transparency, value, and patient centered care. I invite you to take a look at the literature and videos I reviewed. I referenced them at the end of this video. Remember, while consumerism can lead to better decision making, it also has its pitfalls, especially when patients prioritize choice over expertise. As healthcare managers, it's our role to strike the balance and to guide patients to make more informed, value based decisions. Thank you for joining me on this journey into healthcare consumerism. Hopefully, you've gained valuable insights on how we can better navigate these evolving landscape. And remember, it's not just about the lowest price, it's about the best value for patients and providers. I invite you to subscribe to this discussion board and leave your comments below. Thank you.